Hello?
Oh my god, did you hear?
Oh, I'm itching to tell you something.
Itching to Tell You investigates.
Welcome to the first episode in the Itching to Tell You Investigate series. Today I'm joined by dermatological advanced nurse practitioner Carmel to discuss emollient therapy. Today we're going to be talking through what emollients are, why you should be using them, and what options are available and suitable to you. Carmel, would you be able to tell us a little bit about emollients? So what are they and why are they important to incorporate into your treatment regime?
Emollients are products that soften and soothe the skin. They can be used as a leave-on moisturiser or else they can be used as a soap substitute. The idea of the emollient is to restore and repair the skin barrier. They help in psoriasis because they decrease the scale, they decrease the itch, they decrease the inflammation, and they help the skin to feel more comfortable. With psoriasis, a lot of people would have cracks in the hands, cracks in the feet, so they help to repair the cracks as well.
So what is the main purpose of an emollient?
They are important to prepare the skin for active treatments. Mm-hmm. So if you've put on your emollient, you've softened some of the scale, then your active treatment is going to be absorbed better and will be more effective. As you know, with psoriasis, the psoriasis can be thick and can be scaly. So if you have an active treatment and you're pushing it onto that scale, you may as well be pushing it onto a stone. You're wasting your time, it's not going to be absorbed. So your moisturiser or your emollient will soften the skin and prepare it for your active treatment.
I was putting on prescribed ointments for years and they just weren't having the effects that they should have. And it's because I was leaving out that step. With
emollients, we would have promoted the use of them an awful lot in eczema, and we did underutilise them in psoriasis for many years, but over time we've realised the real value of emollients in psoriasis. And ultimately, if your skin is well moisturised and you're using your emollients, you will use less of your active treatment. So if you're being prescribed a steroid, if you just push it onto the scale, number one, it's not going to absorb, and then number two is it's going to take more of your steroid. It's like a dry sponge, you know, the dry sponge just sucks in the water.
Yes.
Whereas when your sponge is wet and you run it under the tap, it just stays on the water stays on the surface. It's the same when you put your emollient on, you've put like a layer on your skin so that when you put your steroid on, it will be more slowly absorbed and it won't be sucked in like a dry sponge. So you use less of your steroid.
I think for anybody who uses a steroid, you want to use it as little as possible. So incorporating the emollient in, as you said, will allow you to be able to use less and less of your steroid.
Yeah. With psoriasis, we try to use as little steroid as possible, or the most dilute steroid as possible. We don't like using potent steroids on psoriasis. It can sometimes make it a little bit unstable.
Yeah, and I think what some people might be concerned about is when it's called emollient therapy, they're thinking, is that another form of treatment, or can I use it in tandem with my treatment? So they actually can be used together.
Oh yeah, the emollients complement the active treatment, and they should be used alongside them because, as I said before, the psoriasis is thick and scaly and you need to soften that for your active treatment to penetrate. Even if you're attending a hospital for phototherapy, the nurses in phototherapy will make you do your emollients twice a day because, again, they want that scale softened so that the light therapy is going to penetrate.
Okay, and so there's obviously a vast amount of different types here today. Yeah. Could you talk me through the different types of emollient options?
So really it depends on your preference, your budget, where you're going to apply your emollient, and whether there is a particular symptom that bothers you. It's great to go into your pharmacist and talk to the pharmacist and tell the pharmacist what your symptoms are. If itch is the biggest issue for you, if the scale is the biggest issue for you, if burning is the biggest issue, or else if you're under the care of a dermatologist or a doctor and they have a nurse, the nurse may be able to direct you either. And there's so many different preparations now, and the companies are getting really good at incorporating ingredients that are very specific to helping people with psoriasis. So there's a particular ingredient called urea. It is a moisturizer or a humectant, like it holds moisture in the skin. But the higher the concentration of urea in the emollient, it also is a keratolytic. And a keratolytic helps to peel the skin or to scale the skin.
Right.
So it comes in 5%, 10%, 20%, 30%, and it even comes in 50%. Usually with the urea, we'd start them off on a lower concentration to make sure that they tolerate it.
Okay.
We wouldn't go straight to 50%, we may start them on 20%, 30% and then move up. If there's cracks in the skin, sometimes the urea may sting a little bit, if you're using the high concentrations. So that's why we would start them off on the low ones as well, just to make sure that we're not going to make them very uncomfortable. So there's ingredients like menthol, which is cooling. So if somebody is complaining that the skin is burning, then menthol is an ingredient that we would recommend for them. If something is thick and scaly, as I mentioned a moment ago, the urea is fantastic. Some of the other companies then, they would have included shea butter, which again is anti-inflammatory, and shea butter is also antioxidant. It contains vitamin A and E.
And then when somebody is trying to choose what emollient will be best suited to them, they obviously have to take a couple of factors into play there, which you mentioned earlier, like maybe what type of psoriasis they have or lifestyle choices and maybe profession.
Yeah.
So if we just look at maybe the different types of emollients for the different types of psoriasis, because there are quite a number of different psoriasis, and is there any ones that they'd be particularly suited, or is it a case of use any emollient for any psoriasis?
As you know yourself, Zoe, scalp psoriasis can be very difficult to treat, and often the treatments were very messy and greasy. Your hair was oily. If you were lucky, you could wash it out. Maybe 3 shampoos later, you might get it out.
4 shampoos.
So again, the companies have got very clever and made formulations that are more cosmetically acceptable and that patients will use. So you can see this lovely foam here. This is designed for the scalp and it's easily absorbed. You can see it's not
very
greasy.
quickly absorbed, yeah.
It's not going to leave your hair greasy. And this contains urea. There's a 10% and 30%. So they would have moisturising and the descaling properties.
Okay.
Without the smell of tar.
Yes.
You're probably familiar with as well.
That was actually something I wanted to talk to you about, because as we know, for years, kind of emollients have been known to be kind of very unpleasant and time consuming to apply, whereas there has been great innovations in recent years where we see the likes of mousses and even aerosols that it just makes it that bit easier for people to apply them.
Yeah, if your scalp isn't too thick, you may have to do, the coconut oil or the almond oil or
to get that thick layer.
To get the thick layer off and then use that as your maintenance. If your scalp is burning, there's menthol scalp preparations as well. Subam do a spray-in menthol preparation for the scalp. Again, they formulated it that it's not greasy. Another tip is if somebody has, some people, their scalp, they would say the worst symptom is that the scalp is burning.
Okay.
And the Aven thermal water, all it is the thermal water, but it just cools down. It doesn't matter whether it's the scalp, the leg, wherever you feel the burning sensation.
Just soothes it.
It just soothes it. It's really good. Inverse psoriasis is it's not as common as the other types of psoriasis, but can be really, really troublesome because it's in It's a very delicate area. It's under the breast, it's in the groin, in the axilla. Can be very red and inflamed because the skin folds are rubbing and you don't have the scale on the inverse psoriasis.
It's arguably more exposed than the other psoriasis because obviously with the plaque it has that layer that's protecting it in a way, whereas with the inverse it's that raw kind of red layer, isn't it?
You see, what happens is with the psoriasis, the cell turnover is very fast, and usually when it comes up, then the cells are immature, so they stick to the surface of the skin.
Yes.
But you see, in the armpits, you're rubbing it off.
Yes.
Under the breasts, if the breasts are rubbing against, like it's the inverse psoriasis is normally in women with large breasts, and it would be that the breast is rubbing off some of the scale, so it never forms. And the same with the...
Obviously there's the presence of sweat there, so that's why it's moist. Yeah.
I would say to my patients, this is like a spray-on Sudocreme. It's not quite the same, but it has...
It's not as thick as a Sudocreme, I can see.
No, but it contains panthenol and it's very soothing for the patients. And you can see it's absorbed very quickly there. And the patients absolutely love that, because if you give them something greasy, if I told somebody to put on emulsifying ointment and they've got it on the breast area, number one, the bra is going to be sticking to them.
Yes.
Or if it's the men and wearing the boxer shorts are sticking to them. So something like this, you can see that
quickly drying.
No grease, no residue left. So that is very useful for them. With people with psoriasis, they often get psoriatic arthritis, so the mobility is affected. And particularly people that are living alone, they can't do the back with the cream. They're sort of trying to reach, and they can't reach the area. It was actually one of my patients that originally introduced me to this, that she bought in the supermarket. And this is just Vaseline Spray and Go. So if they're living alone as well, it's also very useful because they can reach the back, they can reach the legs, they can reach anywhere. It's absorbed very quick, and you can see different companies do different types. The only thing is about using the spray, Zoe, is you do need to have a towel on the ground because these are emollients, so there is oil in them.
Okay.
And you will leave the surface slippy.
Yes,
and
of course.
You don't want to slip. As you can see, Zoe, the companies are getting really good with taking people's lifestyles into account, taking the symptoms into account. So with emollients, it's not one emollient fits all. It's what's your problem, what's your budget, what area are you treating. All those things really need to be taken into account.
And so today we've been talking about, really, you've said creams, lotion, ointment, all these different, so there are different types of emollients. So could you just quickly run us through the different forms that the emollients come in? Okay.
The ointments are the greasy emollients, and they are probably the most effective because they're slowly absorbed and they push the skin, they push a barrier on the skin, lock in the moisturiser. So the next step up step down from the ointment is the cream, and that's a mixture of oil and water in a fairly balanced mix. They are effective. They need to be applied a bit more often than the ointment, but people like them because they are absorbed more quickly.
They're not as unpleasant to apply.
Yeah. The lotions then are a bit more water rather than oil, and they're absorbed very quickly. People do like those, but they're not as effective as the others. So again, what stage is your skin at? If your skin is really well controlled, the psoriasis is flat, the scale is reduced, you may not need an ointment. A cream or a lotion may be sufficient to maintain your skin at that stage. And then if you feel the scale or see the scale building up, then look at something a bit greasier.
So could it be a case of, you might say to someone, if you have very extensive thick plaque, you're best off to maybe start on your greasy, thicker emollients, and then as you see that scale reducing, then you can change to one of your lighter ones?
Yeah.
Okay, so we have the greasy one, we've got the creams, the lotions, and then what other options do we have?
You have the spray, and then the foam as well.
The mousses, yeah?
The mousses, yeah. You know, I would have patients that if I give them a cream, they think it's no good because they're used to the ointment, they're used to the emulsifying ointment, they like the grease and they think that the grease is doing the job. And if it's not greasy, it's not working.
Right.
So, and then there's the other patients that just want something that's going to be absorbed quickly, that they can get on with their everyday life. They may be juggling children, trying to get out to work themselves after they've got the kids off to school. So sometimes it's compromise. It's use something light in the day, like these quick application sprays, and then use something greasier at night time.
Yeah, your more heavy duty ones then.
Yeah.
Okay.
So it's just trying to work the emollient therapy around your life and your lifestyle.
And so then when we think about applying the ointments, getting down to the nitty-gritty of it now, obviously there's different types of psoriasis, so that might also change the way that you apply your emollient. So I know that there's a difference in how you would apply an emollient for the scalp and then how you would carry out the therapy for somebody who just has psoriasis on the rest of their body. So could you talk us through the steps in, if you're applying an emollient to the scalp, what steps should people be following?
If you're applying an emollient to the scalp, you need to part the hair with a comb and then put your emollient on your parting, and then a centimetre apart again with a comb, separate it and apply your emollient along the scalp. Now, if you're using your emollient and you're using it out of a tub, you know, you might be using coconut oil or something like that out of a tub, don't stick your fingers in the tub.
This is something that I was so surprised to see, because I have been doing that for years. I won't even lie to you, where, you know, you open your tub, stick your fingers in the container, apply it to the scalp, but that's a big no-no, putting your fingers in there.
Yeah.
So why is it that you're not meant to put your fingers in the containers?
You'll contaminate your tub, and people with psoriasis, they have scale on their scalp or on the body. So when you do this with your emollient, you've got little bits of scale probably on your fingers,
yeah.
And then when you stick it back into the tub, you're probably left little bits of scale in the tub, and your tub is contaminated. So if your tub is sitting there for a while, you are at risk of getting a skin infection if you have a little break in the skin.
Oh, right.
Yeah.
So you say contaminated. I, as a person who's not medically inclined, I'm thinking, well, it's my own scalp and I'm putting it back in. So is it more that it'd be a case of a build-up of bacteria, maybe?
Yes,
Okay.
exactly. Yeah.
Okay.
So what you want to do is either get a clean spatula, a clean spoon, and just take out an amount of the emollient. Don't scrape any leftovers back in, trying to save money, because again, you will have undone your good work.
Yeah.
You'll end up with a contaminated tub. So it's good practice to decant some of your emollient.
And then once you do scoop it out then with your spatula or maybe a spoon, whatever way you're going to take it out, it is okay then to use your hands to apply it, or your fingertips?
Yeah. And when you're applying it, you know, you apply it in the down direction. You don't want to be rubbing up and down just in case you get a folliculitis. So everybody has hair on the body, and when you're rubbing downwards, the emollient is going in the right direction. If you rub down and then back up, you bring in some of the cream in under the hair and into the follicle. The cream will lodge in the follicle, and again, it can become infected, and they get a thing called folliculitis, which is like little sore pimples.
Okay.
Some of the patients come in, they think that they've had a little bite, they think they might be allergic to the cream, and you say no, and then when we give them the explanation, they totally understand.
That's obviously for emollients you're saying, but if you were just applying your everyday moisturiser or even tans or things like that, that's good practice to be getting into that.
Practice, yeah.
I for years was leaving out the step of I was applying my emollient and I was leaving it in on the scalp and I was just washing my hair, and I was finding that even though it was lifting it slightly, it wasn't really removing the plaque in the way that I wanted to. So what I wasn't aware of is that step where you have to gently scrape out the emollients.
Yeah.
So could you talk us through, people, about that step when, so you've applied your emollient, you leave it in for the prescribed amount of time or for as long as you can, then what's the next step?
Yeah, often if you're doing your scalp with an emollient, I would suggest to patients, if they can, to leave it in for a few hours, ideally overnight. Even put one of the plastic shower caps on to create heat and penetrate, that the emollient penetrates deeper into the scale.
Okay. I just wear a shower cap. I've actually found a nice kind of cotton one, because with the plastic ones I find that you can hear yourself moving all night. But my main purpose for wearing it was to protect the bed sheets. To stop the oils from transferring. So you were saying that it actually does help to kind of let it settle more.
The heat helps to the emollient to penetrate. Yeah, and
great.
Softens the scales.
Doing the right thing.
Right, sorry. But in the morning then, you need a comb and you need to gently, what I would say to people with scalp psoriasis is to comb upwards against the direction of the hair fall, and just do it in a crisscross motion, that the teeth of the comb is just getting in under the scale. You don't want to traumatize it.
No.
So it's just a gentle motion, and when you do it up against the hair fall, it just lifts the scale gently. Again, ideally do it in sections, so maybe take your hair, a bit of the hair to the side and then do up a bit, and then part the hair in different sections and do it. And then after you've descaled, then you wash your hair, and washing your hair at that stage will remove the scale. Whatever loose scale is sitting there that you haven't removed, that hasn't come out on the comb. Yeah,
because I have found that has made the world of difference. As I said, for years I was actually using prescribed emollients, leaving them in for whatever amount of time it was that I'd been told to, and washing them out and not really seeing much of a difference. So that extra step of, as you said, gentle removing, you don't want to rip it out. And I think it's important for people to note, I know myself, that you're not going to get all the scale that first time. So if there are stubborn bits, you're better off just to leave them and say, I'll get them the next time.
Yes, exactly. Yeah.
But so that's with scalp psoriasis. So I imagine that if you're treating psoriasis on the rest of your body, you're not going to go around with a fine-tooth comb and be scraping it off.
No. You want your emollient to do that, and that's where some of the active ingredients come in, like the urea. Now with the emollients, Zoe, generally people put their emollients on first and leave a minimum of half an hour before they put their active treatment on, just so that you're not diluting your active treatment. So between half an hour and an hour, depending again on how busy your lifestyle is. If you're rushing out in the morning, you might do your emollient after your morning shower, have your breakfast, and then put on your active treatment, half an hour after, when it's when the emollient is absorbed.
With mine, for the scalp, I use the quite oily one. So I put my emollient on, I leave it in, wash it out, and then put on my prescribed treatment. But you're saying that with maybe for the rest of the body, you can leave on the emollient, there's no need to wash it off and then put on your prescription.
Exactly, yeah.
Okay.
Yeah.
And would that even apply for the quite oily ones?
Yeah. Now, if it's oily, that's where your 60 minutes would come in, just so that
let it absorb a bit more.
Absorbed well, yeah.
Okay.
Now, with the emollient, a good time to apply is after a shower.
Okay.
Your skin is warm, it's a bit moist. Just pat your skin dry. Don't totally dry yourself, and then put your emollient on, and you'll trap some of the moisture in. Plus, your skin is warm and your emollient will penetrate better into your plaques.
Okay, so there is a time of the day that is preferable then for you to apply your emollient, for it to be that bit more effective.
It is a bit more effective, yeah.
And then, so if we look at then for advice for parents of children who may have psoriasis, what advice could you give them today if they're thinking, what emollient do I choose? And maybe some advice to them about applying emollients for children?
Yeah, with emollients for children, it needs to be something quick and something that's not going to make them feel very sticky and very miserable, because they won't want to engage then in the treatment. And just try and get them involved if you can. You know, maybe do little dots on their arm and little dots on the other arm, and see who can get the child to join the dots on one arm, and see can you join the dots on the other arm, and who was the quickest, or get the child to do the front and you do the back. And again, you know, make it a bit of fun.
Yeah, make it fun for them, so it's not like this chore that they have to do. Yeah.
Oh God, here she comes again with this big greasy tub.
That's what I think when my mother comes towards me.
And again, try and do it in a warm environment, because creams are quite cold. Try, you know, warm them between your hands before you put them on the child. And if they're warm, again, it won't be as unpleasant if you're putting cold cream on a cold child in a cold bathroom. It's just not...
Recipe for disaster.
Yeah. And again, if the child is running out to play, they want to go with the friends, the spray emollient at that time is fine. Right. And then do the greasier one in the evening time.
Today, really, we've discussed so far about emollients can be used in two ways, and we've really focused on applying them directly to the skin and leaving them on. But you can use them in another way, so you can use them as a soap substitute. Yeah. So could you talk to us a little bit about how someone will go about using their emollient as a soap substitute?
Yes, so the emulsifying ointment in the Silcox base, that can be used where they just, you know, cream it, rub it on the skin, and then get into the shower and then wash it. If you're using an ordinary shower gel or soap, it's going to dry the skin because they contain detergents. Okay. So with the emollient, it'll cleanse and moisturise the skin at the same time. Mm-hmm. Some of the different companies then have actually formulated soap substitutes that they just come in a pump dispenser, and it's quick and easy. Some people, particularly the older generation, still like the bath. So that's another form of emollient where they can soak in the bath for about 10 minutes. We don't say to have a long hot soak because that dries out the skin. So you have to get the balance right. So a soak for about 10 minutes. Again, they can dissolve the emulsifying ointment in the bath and use that in the bath, or else there are products that they can just pour into the bath and just soak in the bath, but they do need a bath mat. Any of these emollients contain some amount of grease, and trying to get out of the bath if you put emollient into it, or in the shower as well. The shower tray can be quite slippy, so just be cautious with what emollients you use and if there is a good bit of grease in them.
And I imagine that over the years that you have just heard some amazing tips and tricks from patients, probably some very unorthodox ones. Are there any that stand out in your mind?
One of my male patients, I learn so much from my patients because they're living it every day. I'm not. I'm just passing on the information that I get from patients, or, you know, from the companies telling me about the active ingredients that's in the products. But I do listen to my patients and pass on any information that I get from them. So one of the patients told me about the aqueous cream, which can be used as a shaving cream. Oh, right. Again, cheap and cheerful. He found that the shaving foams really irritated him. So he would cream his aqueous, put it on his face, shave it off, and then wash it. And he said that was what worked for him. So often patients will experiment a little bit, you know, something may be designed as a shampoo or as a moisturiser, and then the patients improvise. And then there's a cost saving benefit as well, you know, if the product does a couple of things. So your Silcox base would do the same. It should be used as a soap, you could use it as a shower gel, and use it as a moisturiser. So
they're multi-purpose really, they're not just one job does all.
Yeah. People have to work within the budget, because when we're asking people to apply a lot of creams, it can work out very expensive.
Absolutely,
If somebody has psoriasis all over the skin and you're asking them to apply emollient twice a day just to help to settle the inflammation, they would definitely go through at least 500 grams in a week. So
you don't want little small bottles that are going to be costing a fortune.
No. What you want is that they can afford the product that they need and the amount that they need. So there's no point in me saying to one of the patients, go off to pharmacy and get this, and they're living on a budget. You know, you have to know what the patient's budget is. So it's easy to go to the supermarket, pick up some of the basic products that they can get in the supermarket, or if they have a medical card, the emulsifying ointment in the Silcox base, they can get on the medical card.
And I believe that all the ones that we have here today are actually ones that you can get over the counter. You don't need a prescription to get them.
Yeah, all these products are just creating awareness. I'm not particularly promoting any product over another product. It's just to let people know what's available and to let people know that it is useful to go to the pharmacist and talk to the pharmacist, because they have such a range. This is only a sample of what's available in the pharmacy. Try and get samples from the pharmacist, because if you go off and you spend money on a pump dispenser and you don't know whether you're going to like it, you've spent 15 or 20 euro and then it's sitting in the bathroom and you've wasted that money. And
of course there is the option then that Irish Skin have that Ask a Nurse facility with you're involved in. So maybe if someone's listening now and they're thinking, God, I really should look into these emollients, but they're thinking, don't really want to go into my local pharmacist because some people might say, I don't want them to know. They can actually just give you a call.
Yeah, they can ring the Irish Skin Foundation. The Ask a Nurse helpline is manned by all clinical nurse specialists and myself that are all in current practice, so we're all up to date with all the treatments, the various emollients, and again, if they describe the symptoms, we may be able to give them some guidance as to, you know, if they need urea, if their skin is very thick, if their skin is hot, whether they need menthol. There's certain tips that we can give them that hopefully will help them.
And if it is a case that somebody's listening and they've never used an emollient before, how do they start off? What's the first thing that they should do to start looking for their emollient and picking one that's right for them?
I would go into the pharmacy and I would talk to the pharmacist and see what samples I could get to try out various products. And again, name your symptoms to the pharmacist, whether it's itch, because you know then that you need something that's soothing, whether it's dry and cracked, you know, you need something that's going to help to repair the skin. It really depends on what is the symptom,
what's your complaint,
what's your preference,
what type of psoriasis you have, obviously, because that could determine which one.
Yeah.
Well, brilliant. Thank you so much for talking to me today, Carmel, because I feel like you've gone through an awful lot of the different options, more than I even thought were available today, and it just really shows to people that there's something out there for everyone. There
is something for everybody, Zoe, and I can't emphasise enough how it is important to be honest with your healthcare professional. If you don't like something, don't pretend you're using it. Let them know your preferences. You know, if you're in the hospital services, there will be nurse specialists there that are very familiar with all the products, and if you tell them what you prefer, what your symptoms are, they should be able to guide you towards something that's going to help you.
Brilliant. Well, thank you so much again, Carmel, for that. And if anybody wants to find out more information on emollients, which ones are available, or maybe what ones might be suited to you or how to use them, check out my social media channels.
For more information on this topic, check out Itching to Tell You on Facebook, Instagram and Twitter.